when we're working on all the teeth in the mouth, or the jaw hurts, or they get migraines or back pain, things like that can be very much related to how the teeth come together. Hi everybody, I'm Dr. Corbin Popp at Colorado BioDental. Many times when we're dealing with comprehensive cases where the teeth have worn down, or the jaw hurts, or they're having a lot of teeth replaced, or they have a lot of veneers and crowns, and maybe they just haven't had it feel just right. Very often it has to do with how the harmony of the bite comes together or doesn't come together. So the bite is a very beautifully designed piece of machinery, if you will. But the way God designed it is it's something that lasts, it chews efficiently. The front teeth protect the back teeth. So bioesthetic dentistry is really just a philosophy of how to get back to the way God designed teeth to work. So what we've done is we've studied with patients that are 50, 60, 70 years old often, what is it in the teeth of these individuals when they haven't worn down, when they didn't need orthodontics, when their jaw doesn't hurt? And we start to say, well, let's look at that, let's study that, and let's use that as a guide to get people back to that when we're working on all the teeth in the mouth, or really worn down teeth, or teeth that just didn't feel right, or the bite doesn't feel comfortable, or the jaw hurts, or they get migraines or back pain, things like that can be very much related to how the teeth come together. So bioesthetic dentistry is really a philosophy of how to rebuild. But I would say one other question is, what is biofunctional dentistry? Because bioesthetic dentistry is really good about rebuilding the teeth because it works on stabilizing the jaw first. Principle number one is jaw stability for bioesthetic dentistry. But taking a step even further back, maybe biofunctional dentistry is where we should start. Looking at not just where the jaw is stable, the condyle, but all of the suture lines of the bones in the head, all of the plates that come together into these little suture areas, they can have strain as well. If we can reduce the strain here biofunctionally, using myofunctional therapy, for instance, that's a good place to start. And then we get the jaw stable. And then last, we deal with the teeth. But these are ways and tools and philosophies that we utilize in our practice to rebuild the bite so that the teeth not only look beautiful, but they function really well, which is just key. So we do a lot of implant dentistry. We do a lot of veneers and crowns and aesthetic dentistry. And when we follow these protocols, we end up with something that is long-lasting, comfortable, efficient, and beautiful. If you'd like to talk a little bit more about biofunctional dentistry or bioesthetic dentistry, or if you have certain teeth or crowns that just have never felt right, or don't look right, or the bite just doesn't come together right, maybe we should have a little discussion on this, and we could learn a little bit about you, and you could learn a little bit about what we do here to try to correct things like that. Bioesthetic dentistry. Many people would say, well, gosh, is that for me or not? That's something that requires quite a bit of consultation and a lot of records to really look and see, is the jaw first stable? What are we actually looking at? Very often dentistry looks right at the teeth and doesn't really look at the big picture. And again, bioesthetic dentistry is going to be a little bit more of a comprehensive look and something that's going to take a step back so that we first find stability before we deal with those teeth. So is this for everybody? I would say absolutely it isn't needed for everybody. But when we're talking about multiple teeth or multiple missing teeth that need to be replaced, especially if they've lost teeth, patients lose teeth often because they're overloaded. They've worn down. They don't cut food efficiently anymore, especially if their teeth have been flattened. So if you lose teeth and you've lost them for a function, that would be a reason to try to really stabilize and rebuild with the proper function so that in the future, they last. So this would be the type of patient that we're looking for that's a little bit more comprehensive when we're talking about bioesthetic dentistry. Now, general dentistry can certainly look tooth by tooth, but it's nice to have the ability to step back and be a little bit more comprehensive. Differences between our practice and perhaps a typical general office. Most dentistry is tooth by tooth. This is why we really focus on a comprehensive look, and we do a very nice, full comprehensive exam because we want to step back. We definitely want to see the forest, the trees, because if we just focus on those teeth, we might not have jaw stability, and whatever we do there might not last. So again, the comprehensive view from our standpoint is what makes us quite different, and that's what gives us that name of being biological or comprehensive or bioaesthetic or biofunctional. And that's what we aim to do for all of our patients. Doesn't mean everybody needs it, but it certainly is something that we offer. So give us a call, 303-988-4949, or look us up online.